Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Okay. All right, Eric, tell me what's going on with your neck. What happened?
Well, I've been having chronic issues with my left side of my neck and my trapezius area, and I've experienced some headaches along with it recently, and I'm looking to find some kind of release in the area.
So how long this been going on and how did you hurt your neck?
I athletically hurt my neck doing some activity about 3 years ago.
Okay.
And over time it just became progressively worse as far as pain and discomfort. Yeah.
So how did you hurt yourself?
Just doing exercises, working out. I practice jitsu, physical activity. Normal reading, computer time, and ergonomic issues, and that's just been cumulative over time.
So currently, how much pain and what motion aggravate your symptoms?
The pain mostly is contribute to a combination of stress, trigger it physically. I would have to do a lateral flexion, or over time I'll get headaches if I sit in a front flexion for a little while from reading or computer work.
Okay. So for those years, did you have any treatment for your neck?
I've tried general massage. I've had chiropractic adjustments. All provided a temporary relief. For myself, I just do rehabilitative exercises.
What's your background?
Physical therapy. And I've done ice, Tylenol, ibuprofen, and all those medications over the counter in order for me to alleviate pain temporarily.
So we want to do the motion that aggravate your symptoms and let me know how much pain.
Sure.
We're going to use that as your baseline. So after the treatment, we're going to try it again.
All right.
Okay. And I want you, when you turn and side bend, just remember how far you can go, like how far your eyes can see. Okay. So let's flex and tell me how that feels.
I'm fine.
Back, extend.
I'm
Okay.
fine.
Rotation left and right. You're really tight a little bit there.
I feel a little bit of tension
How
on
much
that
force
area.
is it?
This is probably a 0.5 to 1, not really anything.
So let's hold it at the end range. Okay, just remember how much you can see. You're basically here, you should be here. Okay, it's almost like 45 degrees. Let's do the other side. You have a little bit more range of motion on the other side. Okay, let's do side bend left and right. How much from 0 to 10?
Just a 1. It's if anything, it's more of a guarded
restriction.
It's just guarded restriction, meaning that if I start to feel pain, I won't take it past that line.
So you stop before you feel the pain, so you don't aggravate it.
Pretty much. I mean,
Yeah.
I feel like I could probably try to go a little bit more, but I don't really. I really don't have that much triggered pain. But what will trigger the pain is if I were to look 45-degree angle, lateral flex, and maybe look up.
Okay, so let's trigger it.
Yeah. It's not triggering yet. I have to be in a certain posture. Right now it's not really doing it, but it takes a certain time, certain movement. Sometimes when I try to alleviate the tightness, I'll
Move it
do this certain
around.
type of motion like right here. And then at a certain point in time, it'll give me a sharp, notifier that, oh, that hurt.
Oh,
Yeah.
okay.
Yeah, so it's specifically one of these right there. One of these.
How much?
Right
from 0 to 10?
Huh?
How much did you feel it?
It's guarded, but it's one of those sudden, like, oops, one of those, yeah.
Okay, when that happened, how much usually happen?
Sharp, it would be probably maybe a 5, 6.
So we're gonna try that after the treatment and see how you feel.
Okay.
Okay. Oh, this is the one you're talking about, yeah?
Yep.
Okay. Make sure it's not painful. Alright, so I'm gonna go deep actually to release your deep fascia actually with this tool. How does it feel?
I'm okay.
Okay. Make sure it's not painful.
Not painful. I just feel the pressure.
So this is the A5. This is actually what I use to release the deep fascia, the premiycin and the endomycin. You said you have a herniation or something like that? Or
I'm sorry, say again?
did you have a disc herniation?
No.
No, okay. Is that too much?
No.
Do you get headaches?
Yes, I do.
How often?
Sometimes 2 to 3 times a week.
Okay. And where do you usually experience a headache?
Starting from that left side base of my neck,
Mm-hmm.
and then to the left orbital frontal area of my.
And do you have a headache today?
No.
Okay. Is it painful? It's okay.
I'm fine.
Yeah, your fascia is really tight here.
I know everything.
Yeah.
Even front.
Mm-hmm. You feel the tightness here?
You know, see the point, it's so tight. I don't even know what tight is.
So, normal fascial mobility should move like, let me show it to you here. You feel this mobility? Sorry about the construction that's happened here. You feel this mobility? That should be a normal fascial movement. Let's compare this to this. Can you feel that? That's tight. That's a superficial and superficial fascial tightness. So I'm gonna release it now, okay? It's right here. Okay. You feel the mobility now?
A little bit.
Start here. You're gonna go deeper. But make sure it's not painful, okay?
I just feel like a rug burn.
These are the fascia tools. So I can release the epimycin, the premiycin, endomycin with this. You will never be able to do that with metal tool to go deep in the body. And these for the releasing superficial and deep fascia. You have to grab to the fascia. Period. Is that too much here?
Right.
Okay, make sure you feel that bend here. This one?
Okay.
Sorry. Make sure it's not painful. You see how deep that's going in? That's basically double the size of the rubber. And I will show it to you. So I cannot even do that with my finger because my finger is very thick.
Right.
And if we, like we learn in the school, you do fascia release either with the knuckle to do deep release or the elbow. Mechanically, you cannot go deep.
Like, I know, and typical, right, and that's something like if you were to go to a typical massage, they wouldn't know how to release or even go to that certain specific muscle that you're getting to. I know that's a major muscle that's causing a problem.
But you're not getting there. How do you release it?
You can't. You need a professional to do it.
Yeah, and you need to have tools. You need to have something to go deep. Like I will show you how much it went in. That's probably a good 2 inches. Okay, so you see this? it was all the way to here. Went deep inside.
Mm-hmm.
In this spot. Feel that? So now, because I'm able to go deep, I can release it. If there is no inflammation, usually there is a take a few treatments, 1 to 2 treatments. You feel the tightness in your fascia here?
Oh yeah. That's
Okay. If you cannot grab it, how you assess it's released?
right.
You know,
Okay.
if you slide the metal tool on it,
Right.
and you know how you claim that you did fascia release, because the tool is actually gonna hit the superficial fascia only. What about the apparatic fascia, the epimysin, the premiysin, and endomysin? You did not even touch those. How do you release it? Sorry, is that painful? Make sure it's not painful. Okay?
Yeah, it's painful. I guess the thing is, I gotta find my levels of tolerance.
Make sure it's pain-free, okay? So I'm gonna show you the scar tissue in here. Oh, that's right. You made a mess here. Now.
Yeah, I've been having an issue with that area for a
Yeah.
long time. Pec minor, all the attachments to that
So-
process.
Yeah, you have the metal tool. I will let you hold this and do it in yourself and tell me, can you tell any difference? Yeah. How does this feel compared to the metal tool?
It's I would say compared to the metal tool, it's actually more conforming to the area.
Mm-hmm.
It's versus a simple blade.
Mm-hmm. How
So
about the use ergonomic-wise?
I guess ergonomic is more better. I mean, for the user, for the actual practitioner, I guess it would cut a lot of cumulative stress
On the
user
wrist. Yeah.
from the user.
Mhm.
Yes,
Yeah.
versus traditional methods of doing it manually, physically, or with any other tool.
With the blade, because the blade you use your small muscles, so you're using your small muscle, you're actually gonna have a strain. You feel that here? Sorry.
Yeah, you're all right.
Mhm.
I know there's got to be a level of intolerance.
No, but make sure it's not painful, okay?
It's been like that for a while. I mean, you gotta break it. You gotta break it.
Well, yeah, but we don't want to cause inflammation. Well, as long as we're careful, because if you cause new inflammation, you're going to cause micro trauma that will cause more scar tissue. And I had actually a patient that went to therapists that did the metal tools. They will have like bilateral carpal tunnel. After the treatment, it's actually bilateral carpal tunnel plus bilateral tennis elbow. Because the therapist was so aggressive that caused me more trauma. For this one here. I'm going to use like a special magnet coated with anti-inflammatory, natural anti-inflammatory, to really get localized inflammation down. Okay. You want to see how strong this magnet?
Sure.
So just lightly push my hand so to feel the force. You feel it?
Okay.
Yeah, so we measured it was like 4 to 5 inches, the field in between them.
So they're opposing polar opposite.
Mm-hmm. So I really can get 4 inches deep to 5 inches internally when I have them like this.
And what's your rationale for the magnetic use?
So when they measure the normal cells voltage, it was running between 25 to 20 millivoltage. The inflamed cells or injured area, the voltage went down to 5 to 10 millivoltage.
Okay.
So think about this way. You know, the cell membrane, you have lower voltage, so there is less communication.
Okay.
Okay? So think about this way. If your phone runs on 5% of your battery, you're barely making phone calls. So you're not gonna really be able to open apps and using your phone properly.
Right.
The same thing, when the voltage is low, there is less reaction or activity in the cell. So you're stuck in the inflammation stage. So with the magnet, because we know the body communicates with electromagnetic fields, we try to increase the voltage in the cell. It's like a charging the cell. If it's a mild inflammation, usually 1 to 2 treatments with the magnet should be enough. For chronic inflammation, sometimes they have the patient just wear it for several hours a day. And we did measure the temperature, and I had it in the video too, that with inflammation you have to increase temperature. We found like at least 4 degrees decrease of the temperature when I did the magnet for a few minutes. Okay, let's try it again and tell me how that feels. And the side bend and rotation. How's that?
I barely feel it.
Mm-hmm.
Barely.
Okay. So if we say 100% back to normal, how far you are now?
99.9.
Okay, it's not bad. Yeah. So because your background physical therapy, what do you think about the treatment?
I think the tools and the philosophy in how we treat the injury as a whole is something that, direction we should go towards. Because just treating one area in a very superficial type of way is probably not beneficiary for the long term.
Yeah. Awesome. Thank you.
Thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!